So today is a very common topic, that is pregnancy, diagnosis of pregnancy. Huh? All of us know about the pregnancy. This is our subject. Pregnancy, can you imagine what a miracle of life that is?
Yes, ma'am.
That is, so diagnosis of pregnancy is, any story about the confusion regarding pregnancy like pseudocyesis, sometimes ovarian tumor, uterine fibroid, misdiagnosed as a pregnancy. So, it is a physiological condition or pathological? Physiological. Okay. So, and first of all, when pregnancy when occurred during reproductive life, that means when ovarian function started and going on. There, can you imagine? There one baby 9 years. In history in Peru, she conceived at the age of 9 years. There is a story about this. So at any time, when ovulation starts, if there is coitus, she can be pregnant. So that is now today I will discuss about the diagnosis of the pregnancy. That is important for written and viva, everything. All the pregnancy we divided in 3 parts. Trimester means 3 months, everything. 3, 9 months. So timing duration of pregnancy is 9 calendar month plus 7 days. There is a nasal's role, that is 9 calendar month and 7 days. That is the nasal's role for timing of delivery. What are the way of diagnosis of the timing of delivery? From the date of quickening or from the date of fruitful coitus, like this, if there is a history, and from the early ultrasonography findings. So sometimes there is a question, how can we diagnose the duration of the pregnancy, or how can we find out the timing of delivery? That is expected. EDD means expected date of delivery. Expected delivery. So most commonly we use the nasal's rule, that is 9 calendar months plus 7 days. I think everyone knows about the date of delivery. Okay. So now first trimester of the pregnancy, that is first 12 weeks. First 12 weeks of pregnancy. So first 12 weeks of pregnancy, how can we diagnose? From the symptom and sign. Symptom, sign and laboratory investigation. Okay. So from that time, you saw here there is a pregnancy card. You saw it. What are the components from here? You can show the patient. Can you come? Come. You can show. You can. What are the points here? Yeah. That is pregnancy card. Here. That's okay. Here we have an antenatal card. Okay, that is a checkup card. As documentation is so important. Okay, this is the pregnancy card. Ardin Medical College Hospital. That is for why it is to record the findings. Why record is important? For further progress or any plastic what is her findings is so important. So here the identity of the patient, and then you see some advice of the patient, and then about nutrition, what food needed the patient, the pregnant mother, and then from history you see there is everything is written, complaint, that is the protocol of the antenatal checkup, investigation, what is vaccination, and the findings here. What are the findings? Height.
On examinations, on journal examinations, like we should mention the findings like about height.
Height is important. thought if you get the cortical pregnancy, maybe contracted pelvis. So, which is high risk pregnancy, maybe it is high risk pregnancy. Okay? So, there is a two term. There is a high risk pregnancy, another is normal pregnancy, maybe listening to the normal pregnancy. Okay? So, to exclude the high risk pregnancy, one of the important points for the antenatal checkup to exclude the high risk pregnancy or to diagnose the high risk pregnancy. So, height is important. Age,
Weight of the fetus.
and then the age is important. Why age is important? Age is very important. If they less than 18 years and more than 35 years, then the complication is also high risk pregnancy. So age, height, BMI is also important. If BMI is more or less and or more, then it is associated with what? BMI more than it GDM or hypertensive disorder, or there is other complication is more in preterm labor, or more in the complication is more during if BMI is more. Okay, then
In general examination, weight of the fetus. Then anemia.
no, fetus, no, mother. This is the mother findings. BMI. Okay, anemia. Why anemia is important? Mother anemia, why important? Anemia is the silent killer of our body. Anemia is the silent killer of our body. So anemia is associated with so many complications of the mother and the fetus. Suppose mother heart suffering, general weakness, chronic UTI, and edema, and cardiac problem, respiratory problem, chance of infection, and fetus, preterm labor, miscarriage, recurrent abortion, and other sort, IUGR, stillbirth, like this. So anemia is important to correct the anemia, or anemia what is at least above 10 gram should be then.
Then jaundice, edema, and pulse, BP, heart, lungs, and others.
So why pulse BP is important? Blood pressure should be normotensive. If there is hypotension or hypertension, that is gestational hypertension, is one of the complication of during pregnancy. So it is important in every antenatal checkup. How many antenatal checkup?
4.
At least 4. So antenatal checkup, every antenatal checkup have some objectives. Main objectives is to diagnose the high risk pregnancy and to normalize the pregnancy, that is should mother and fetus well-being. We should know the well-being of the mother and the fetus. If any problem, we should solve the problem. That is the objectives of the antenatal care. Okay, then investigation. Okay, and then we know the per abdominal examination, the fundal height, it's a presentation.
Fundal height, then a liquid condition, presentation of the
What is presentation? The lower part of the fetus who is present in the pelvis, the part of the fetus who is present in the pelvis, and liquor. The amount of the liquor is so important. Why amount of liquor is so important? You know that term oligohydramnios and polyhydramnios. So if there must be some reason behind the oligohydramnios and the polyhydramnios. So we should find out the amount of the liquor. Then how should I find out? Clinically and by ultrasonograph. Then
the condition of the fetus, whether that is floating, fixed, or engaged, and then fetal parts, fetal movement, fetal light, and then fetal heart sound.
There are some normal fetal heart sound how much? 110 to 160 per minute. Then investigation, what are the investigation?
In the investigations, blood for hemoglobin percentage, then fasting blood sugar, random blood sugar, 2 hours after
Postprandial blood sugar after breakfast.
2 hours after breakfast, then grouping, then...
You know the 2 hours after breakfast, we do the blood sugar, that is more important. Or postprandial blood sugar.
Then VDRL, then
SB,
HBsAg for hepatitis B infections, and then urine for routine examinations, then especially albumin, and USG for pregnancy profile, husband's blood group of RS negative mother, then OGTT with 100 grams.
RS negative mother, why it is important? To prevent RS isomionization. Why, what we give? NTD vaccine, antibody NTD vaccine. You know the NTD vaccine? To prevent RS immunization. Then oral glucose tolerance test if it is needed. Okay, so I show you our antenatal card. You should take some print from this. Okay.